Ageless Living. This is your host, Dr. Tong Lee.
And your co-host, Kurt Wilhelm, here on Ageless Living, where you learn many, many aspects of how to have a well-rounded, beautiful life experience from the standpoint of fashion, beauty, and also image.
And balance.
And balance.
We love that word.
We do.
And this show, we're going to talk about arthritis, which is brought up by a friend of mine who said, you know what? Everybody has diabetes and arthritis. You know, I looked up in the statistics, guess what? According to government surveys, 33% of Americans are suffering from some kind of arthritis symptoms, swelling and pain and all that. And this number jumps up to over 50% when we're talking about age 65% or more, yeah.
That's a big deal.
So that's like half of us, age 65 or so is having arthritis problems. So it is a issue that most people care. So who likes to have pain? So this is one of the source of pain in life that we don't like to have. So arthritis is something we try to divide it and say, well, what causes it? What kind of arthritis we have? Well, it matters a lot because we like to make sense of things. People like to know why we have arthritis. I mean, there are two big general categories of arthritis. One kind is the kind that we know the cause. The other kind is the kind we don't know the causes. The first category is actually a small percentage. See, it goes back to how little we know, how little our knowledge is in medicine. It's limited. The known kind of causes are injuries. If you banged your knee on something and you fell on it, you injured it. That's arthritis, caused by injuries. The other kind is infectious. It was caused by infection, bacteria or some other kinds from other parts of the body. The other kind is metabolic. You can call it gout. That's a type of arthritis too.
Oh, I didn't realize that's what gout
was.
was.
Gout is
similar.
It's caused by excessive level of a kind of acid, uric acid level in the blood.
Gotcha.
So these kind of actually are self-limiting in a way, because if it's infection, you treat it. If it's injury, you let it heal, and baby it, pamper it. Gout, you control the uric acid level by taking the medication or watch your diet. So these things are actually not the arthritis most people worried about.
Okay.
The group, the big portion of it is the unknown causes. In this group, and there are actually two kinds. One is degenerative, one is inflammatory. Degenerative is degenerative type of arthritis are most of the time called osteoarthritis. What does degenerative mean?
Sounds bad.
What it really means is it happens when we get old. Or we think that's what's causing it, aging or getting old is causing it, and we think it's degenerative, and it's really not clearly known.
At some point in the show, not right now, because I'll make us deviate too far, is that the two things that people talk about that cause arthritis are popping your knuckles and running too much. So
we actually will
talk
about that.
Yes.
This is, I think these two things are very relevant, especially running. We will talk about that because it's very relevant. I'm glad you brought it up.
So stay tuned.
Absolutely. So the question, the golden question is running bad for your knees or bad for your joints? Mostly for the knees and ankles, because that's where weight bearing happens. So we're going to touch on that question. So going back to the causes. Degenerative, inflammatory, we talked about degenerative, the fancy word for getting old or not clearly known. And osteoarthritis is the diagnosis or the name for degenerative, most of the degenerative arthritis. That's the most common one, actually. If you look into your family doctor's notes or diagnosis. Inflammatory arthritis, only 5% of our population suffers from it, so it's not that common. That includes, those arthritis includes psoriasis, causing arthritis. Psoriasis actually can be a systemic disease. It's an autoimmune problem. It can manifest as arthritis and skin problems and even heart problems.
I didn't realize it was so many
That's
things.
right. So is lupus.
Oh.
Lupus is also a immunosystem problem, and the disease can have some symptoms and show some symptoms in the joints as arthritic pain and swelling and all that.
Interesting.
Another name is called ankylosing spondylitis.
I can't even pronounce it.
Well, it's a rare disease. It is a
Uh-huh.
rare disease. Like I said, out of all these inflammatory arthritis, only 5% of people suffer from it. Now think about the 50% and 33%. They're rare. So bottom line is the most common one is the degenerative arthritis, which is also commonly called osteoarthritis.
Oh.
A lot of times those are associated with bone spurs.
Uh-huh.
That's another sign of degenerative change.
Wow, I
So-
actually had that when I was 25, but I brought it under control. I may ask some questions
There
about
you
that
go.
later.
There you go. We age at all ages.
Sure.
I tell my 13-year-old, I said, you know what? He thinks, Christmas is coming sooner and sooner, quicker and quicker, just like the toilet paper. Toward the end, it goes faster and faster.
Yeah.
I'm like, you're only 13. So.
Yeah, you keep getting faster.
Absolutely, absolutely. So these are the bigger picture of how serious and how common arthritis as a disease affect our lives, and the causes. We categorize them that way. So, for the most part, for most people, degenerative change is what concerns them mostly, and that's another one that's not so well treated. I mean, if you have infection, we treat the infection. If you have injury, we know, we let it heal. What do you do with degenerative change, which is aging and not very well known why?
Yes.
So that goes to, holistic health.
I was so excited when Dr. Lee decided to create the show on this subject, because cancer and arthritis are the two things, for whatever reason, are the things that scare me. And so I'm really excited to hear the great wisdom that Dr. Lee has to share with us. And by the way, when we talk about Dr. Lee has medicinal degrees both in Eastern medicine from China, and she also has her certifications here in the United States as well. So she has her Western medicinal degrees as well. So she is able to see both sides of it, and so I love hearing the great tips that she has for us. So I'm waiting with bated breath.
Well, I'm glad. I do want to point out, when we're going to talk about herbal medicine and alternative health, integrated medicine, or holistic medicine, trying out herbs and other things is not without risk. So there are people who are so desperate, they'll just try anything.
Right.
There are risks out there, so you gotta be careful with it, and always, check with if you're eliminating a group of foods from your diet, check with your dietary experts or your doctor. Same thing with trying herbal medicine. It's sometimes with risk. I research on both English and Chinese literature all the time on whole health and alternative health type of issues. I actually came across some reports of renal failure on people just blindly, without advices, just take some herbal supplements thinking that anything would be better than nothing, and
Sure.
herbals are natural, so it's without risk. It's not completely without risk. So,
Sure.
so I want to remind everybody on that.
Mm-hmm.
And the health tip of the day today, we're going to share with our audience, listeners, some really, really good arthritis tips that's not something you ingest. So it's a little more safe. You put it on your joint
Great.
to relieve arthritic pain and swelling. So
Wonderful.
we're going to go over that soon too. So the next what I want to ask you, Kurt, is
Mhm.
why are you so afraid of arthritis?
I think
I
it's
mean,
because
we're not going to talk about cancer today. So.
Yeah, that'll be a different topic. But, you know, there's three things I really, really, really value. One is my eyesight, one is my hearing, and the other one is my ability to lead an active life. And it just would crush me if I had to limit my activities.
Have you experienced some of those limitations?
A little bit, once in a while. You know, I've had a surgery or two. I had a hernia operation, and during that 2 weeks, I was just about to come unglued because I had to be in bed, you know.
You know, that's the thing. When you have, I've actually experienced some of those joint pain before, so I know how little thing, just pain, can really limit your life, and it's annoying.
Yeah.
So when we come back, we're going to talk about basically what kind of a dietary things you can do, what kind of foods to avoid, what foods to eat or to ingest that would be better for health and your joints.
And I'm excited to hear about them too, so don't go away. We'll be right back after the break.
Stay tuned.